So his topic is to correlate between Pentacam nuclear density grading and LOX3 grading in senile cataract.
Can I start, sir?
Yes, sure.
Good morning, everyone. I'm presenting my topic on correlation between Pentacam nuclear density and LOX3 grading in senile cataract. Since the cataract is the global health issue and particularly among the adults and is caused the major cause of reversible blindness in the worldwide, so the early diagnosis and appropriate therapeutic intervention is necessary to control the burden of the disease. There are several risk factors for the cataract, including the increasing age and exposure to ultraviolet radiation. Other is steroid exposure to long-term steroid and oxidative stress, obesity, and smoking. So for the evaluation of cataract, we are using from the LOX3 grading system, which consists of slit lamp imaging, which include the nuclear cataract in 6 graded on the basis of color and opalescence, and the cortical and posterior subcapsular cataract into 5 grades with the help of retroillumination images. By the Pentacam, it is a non-contact device, so we can image the three-dimensional images in just a second and hold the three-dimensional images of interior segment and lens is imaged, and it is based on Simpling imaging system. So in this there is a Pentacam and LOX3 system. In this LOX3 system we have a nuclear on the basis of nuclear color and opalescence. There is 6 graded, and in the Pentacam we have three-dimensional images of the whole lens, so we can grade according to the opacity of the lens into the 5 stages. This is the same picture that patient have nuclear sclerosis grade 5, and in this there is a Pentacam nuclear density which evaluate the patient with nuclear opacity. This was a prospective interventional study which is performed at the RIO Prayagraj, which is tertiary care center associated with MLN Medical College. The inclusion criteria include the patient with age more than 50 years and patient with the senile cataract, and exclusion criteria is patient with corneal opacity, glaucoma, pterygium, ocular trauma, ocular surgery, abdominal pupil or iris, and vitreoretinal disease. After explaining the procedure and pre-operative workup, that is uncorrected distance visual acuity and corrected distance visual acuity, and the non-contact tonometry for the IOP, and slit lamp examination, fundoscopy, specular microscopy, and IOL master for the biometry. And this slit lamp, the cataract grading was performed with the help of LOX3 and Pentacam. Coming on to the result, the demographic data include the there is the high prevalence in patient with age more than 60 years, and LOX3 grading and Pentacam nuclear density grading was almost similar. That is grade 2 in 38% cases of 38% cases, and Pentacam nuclear staging was grade 2 in 43% cases. This is almost similar. And the Pentacam, according to the Pentacam nuclear density, there is a percentage endothelial loss after the post-operative cataract surgery. In there is a strong positive correlation between the total cumulative dissipated energy and endothelial cell loss. That is, if there is increase in CDE, that is increased loss of endothelial cells, and there is a strong positive correlation between the Pentacam nuclear staging and LOX3 grading. The Pentacam nuclear density is also strongly positively correlated with the cumulative dissipated energy of the phacoemulsification. So the current study was conducted to evaluate the correlation between Pentacam nuclear staging and LOX3 in cataract grading to determine the relationship between the Pentacam nuclear staging and cumulative dissipated energy and endothelial cell loss. The present study include the study subjects of more than 60 years, which was age-related of non-modifiable risk factor, And in our study, we found that about 60% of the patient were female. It is due to the estrogen withdrawal effect, or after menopausal, there is increased risk of cataract. In our study with the Pentacam, nuclear density of the study subject increases significantly with the increase in the grade of LOX3 grading of the lens opacity with correlation coefficient of 0.948 with p-value of 0.01, which suggests that there is a strong positive correlation between LOX3 and Pentacam nuclear staging. This similar study was performed, and they have found showed the correlation coefficient of 0.845 and 0.765 at p-value of 0.01 respectively. There is a strong positive correlation between the Pentacam nuclear density by the and the cumulative dissipated energy. This finding was similarly that is the study conducted in Chandigarh, India by Gupta and all, and so there is linear positive correlation between Pentacam nuclear staging and cumulative dissipated energy. The proportion of intraoperative and postoperative complication of phacoemulsification surgery among the respective participant of was identified as 6.6% and 11.6% respectively.
Your time is up. Please try to wind up.
Yes. So by the modification of the surgery, there is a less post-operative complication as observed in the previous studies. One patient has a posterior capsular rupture which was managed, and with the anterior vitrectomy and PCIOL implantation was done, and one patient has intraoperative iris prolapse which was managed successfully with the low vacuum and low irrigation flow.
Please conclude, otherwise we'll have to switch it off.
One patient has post-operative descent folds and edema, so AIOS2025 was found and dyspeptopexy was done. So the conclusion in this study is we found that LOX3 staging is a significant positive correlated with to the Pentacam nuclear density. By the Pentacam nuclear density, the exact density of the nucleus can be determined, which help in removing the subjective bias of the LOX3, and it is less time consuming. The study evaluated the positive correlation between Pentacam nuclear density and CDE and LOX3 system. In this study, we have found that less endothelial cell loss by the modification of surgical technique according to the preoperative evaluation.
Thank you, Manendra. The only concern is your study was regarding the grading of nuclear.
Yeah.
So why did you bring in the endothelial cell loss in those cases?
Sir, in this cases, sir, nuclear densities are evaluated, and the preoperative modification was done. Stop and chop technique or pre-chop technique was done to.
But was that a part of your study? Your aim was not to see what will be the loss of endothelial cells. Okay, thank you.
No, even otherwise, you see, if you are in a higher institution where you have all the equipment available and residents available, it is fine. Just for doing it, you do it. Otherwise, what does it add to your this thing? With LOCS, surgery has been going on for ages. How will this add to anything? I mean, what additional help does it give you in surgery? It is a good thing that, okay, you've done it, sort of corroborates and all that. But there has to be, do you know the cost of Pentacam?
Yes.
So just to classify cataract, I think if you ask somebody to get a Pentacam or get a Pentacam scan done, I don't think it is justified.
You
But
must be
fine,
having a
for a,
Pentacam for some
that's
other
what,
thing,
in an institution where it is there, it is fine. With PGs you do it. But it is not something which can be added as a routine armamentarium that you do a Pentacam in every case to decide the density of the nucleus.
Thank you. Thank you.